Okay.
Okay, that's great. Now start.
Hello, my name is
Hello.
Dr. Zainab. My name is Dr. Zainab. I'm one of the F2s here in renal unit. Can I please know your name, please?
Yes, doctor. My name is Alex.
Nice to meet you, Alex. So I see that you are in your third year of medical school, right?
Yes, doctor. Yes.
Okay. So how's that been so far? Are you enjoying the clinical rotations?
Yes, everyone here is great. I just started my rotation 1 week ago, and everyone here is very nice to me.
That's great. That's great. Okay. So I see that you want to learn urine dipstick, right?
Yes, doctor. Actually, yesterday I was seeing one of the doctor performing this procedure, so I was just curious to perform this.
Mm-hmm. Okay, that's great. No worry. I'll teach you the whole procedure. But before we jump on to the procedure, can you tell me, do you have any background knowledge or any idea that why we perform the urine dipstick?
No, doctor. I don't know anything about this procedure.
Okay, don't worry. Okay, so there are certain conditions for which we perform the procedure. So you should be aware of those indications that why we are going to perform this particular procedure. For example, regarding urine dipstick, we perform it mostly to rule out any sort of infection, any if there is to see if there is any blood coming in the urine, or to sometimes we do it to confirm pregnancy, and for diabetics particularly we do it. Okay. Okay, so regarding the procedure, there are certain protocols and certain guidelines that we need to follow, and I'll be teaching them to you thoroughly. And if at any point you feel that you want me to repeat something, you can stop me there and I will repeat it for you. Okay.
Okay, that's great, doctor.
Okay, so okay, there we have first of all, before starting any procedure, you have to make sure that you follow the standard protocol of sanitation. Regarding, you need your equipment ready, and we will be starting. First of all, we will be sanitizing our hands, and I'll be wearing my apron. Do you want one for yourself as well?
No, thank you, doctor.
Okay. So I'll be wearing my apron and I'll be wearing the gloves. And after that, I will be taking the urine sample that is present in this jar. Okay. So first of all, we confirm the patient's details on the sample. Okay. You do not want to intermix the samples. You make sure that you are checking the right sample for the right patient. So confirm that the patient's name or the patient's record number on the sample is correct. And after that, what you need to do is we'll be opening the jar, and we'll be assessing the color of the urine. Okay.
Okay.
So as we can see, what do you see? How would you define the color of the specimen?
Doctor, I don't know what is the normal. I think it's straw color, the normal color. I'm not sure about it.
Yes, 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 you're right. You're right. The normal color of the urine is straw colored, and this is straw colored urine. So that means it is normal. The color can vary from depending on if the patient is having any particular pathology. And if you want to learn about that, I can tell you that as well.
Uh, yes, doctor.
Okay. So, as you have just told me that the normal color of the urine is straw colored, and this is straw colored urine, this is just the normal sample regarding the color. Okay. So, if it is darker in color, that could indicate the patient could be dehydrated. Okay. And if the color is red, that is, it could indicate the presence of blood in the urine, or it could indicate that something as simple as that the patient has eaten something like beetroot, or it could indicate the presence of any drugs, or any hematuria present, or something as serious as porphyria. Am I clear?
Yes, yes, doctor.
Okay, that's great. So moving on, after the color, you assess the clarity of the urine. Is it clear or is it not clear? Okay.
Okay.
Okay, so as for this sample, we can see that the urine color is clear.
Mm-hmm. Yes.
And regarding the clarity, it indicates certain stuff. If the color is clear, it means that the sample is fine. If the color is not clear, it could also indicate certain pathologies. For example, if it is a frothy or if it is cloudy, it could indicate the presence of proteins in the urine, or it could indicate any infection such as UTI. Okay.
Okay.
Okay, so we have assessed the color, we have assessed the clarity of the urine. I will be opening the bottle and will assess the odor of the urine. For example, we know how normal urine smells, right? So we'll try to look for anything different. If, for example, if it is too sweet, it could be that the patient is diabetic, and diabetes, the urine smells sweet. And if it is too strong or too pungent, it could be UTI.
Okay.
Okay,
Okay.
so what we have done so far for regarding the sample, initially we take the sample, we look for the color, we look for the clarity, and we assess the odor of the sample. Okay, next we what we do, as we are going to perform the urine dipstick. So we'll be taking the urine dipstick jar. Okay, as you can see on the jar, there are certain markings. There is a urine dipstick analysis chart present on the urine dipstick on this bottle. So there are certain parameters on the jar. For example, glucose, bilirubin, ketones, they are all mentioned over here. And at the end, we will be interpreting our results by correlating with this chart. Okay, is that clear?
Yes, yes.
Okay, so before opening the bottle or before doing anything, you want to make sure that your dipsticks are fine and they are not expired. Okay, so first of all, you go and you check the expiry of the urine dipstick jar. Okay.
Okay.
Okay, so as we have confirmed that it is not expired, what I'll be doing is I will be opening the urine dipstick jar. I will be taking one urine dipstick out and closing the jar immediately to prevent oxidation of the rest of the urine dipsticks. On the urine dipstick, you will find a number of small little squares, okay, small little boxes. These are basically the regent squares that are specific for every parameter that we are going to assess in the end. Okay,
Okay.
is that clear so far?
Yes, doctor. Yes.
Okay, that's great. So after taking out the urine dipstick, I will be dipping it inside the urine specimen, completely immersing it, making sure that every regent square is completely dipped in the sample, and then I will be taking it out immediately and rubbing it off at the edge of the jar to make sure that any excess urine is out, and then I will be placing it horizontally onto the paper towel.
All
Okay,
right. All
you do
right.
not want to hold it vertically. You do not want the regent squares, the cross contamination of the chemical present on them. Okay.
Okay.
Okay, once I have it out, I will place it on the paper towel and I will start my stopwatch. Okay, as I just told you that we check these parameters like glucose or bilirubin or ketones or proteins. Okay, we do that at a particular time interval for every parameter. For example, I will set the timer for 30 seconds, and after 30 seconds, I will take my strip and I will correlate and assess its result on the urine dipstick analysis chart after 30 seconds. Okay.
Okay.
Okay. Um, after performing and after calculating the results at specific time interval for every parameter, I would be discarding the urine dipstick into the discard bin. I will be discarding my apron and my gloves. And to complete the procedure, I would like to document the findings of my investigation, my procedure, what I have just performed.
Okay,
Is
doctor.
that clear?
Yes, doctor. So, doctor, what does the cloudy urine means?
Okay, that is a very good question. As I just told you before, that if the urine is cloudy, it could indicate the presence of proteins in the urine. Now, do you have any idea of any certain conditions that cause proteins to be released in the urine?
No, doctor.
Don't worry, don't worry. I'll tell you. There are certain. Do you want me to tell you about that?
Yes, sure, doctor.
Okay, so there are certain conditions in which the patient start losing protein in their urine. Okay, for example, one of the commonest example is nephrotic syndrome.
Okay.
Okay,
Right.
or it could be or it could be any protein losing situations or anything. But the most common at your level that you should be aware of is nephrotic syndrome. Okay,
All right.
do you have any other questions?
No, thank you so much. You have just taught me thoroughly each and everything. I'm happy about it.
I'm very glad that I could be of any help for you. And regarding your rotation for the rest of your time that you are, if you have any query or if you face any problem, you can come to me. Okay.
Okay. Thank you so much, doctor.
Nice.
Okay.
Okay. Thank you.
Okay, that's great. Okay, so first, just let me tell you about your time. It's almost 10 minutes and 40 seconds. Okay,
Oh.
so don't worry about it. It's just the beginning. Don't worry. So now we will discuss about the things that what we should do and what we should not do. You,
Mm-hmm.
you, you. First, I will mention the good things. You did the station very well. You explained each and everything thoroughly. That is sorry. That is good. That is a good thing. You have knowledge, you have everything. But remember, you have 8 minutes, and your main task was to teach, not to explain each and everything, not to explain about abnormalities. So you, hello, can you hear me?
Hello.
Yes, yes. Am I clear? Hello.
Yes.
Yes. Okay. So,
Hello.
so you explained each and everything. You covered each and every safety points, and you covered each and everything thoroughly. But the thing is, you do not need to explain each and everything, like the color, clarity, and the odor, everything in details. Your main task is to teach.
Hmm.
So we will start from the beginning how we can decrease our time. The first thing is the grips, the introduction part. You did well. You confirmed about RU, Alex, and you started session well. But it would be better that in the scenario you already know that the student name is Alex. When you enter into the room, you can say like this: "Hey Alex, how are you? So how's your rotation going?" You can start that you already know about Alex because you and Alex, in normal circumstances, you both are working in a unit, you both know each other, so we can
Mm-hmm.
start station like you have to show something different because in on the exam day there will be around 92 candidates, they all will be following the same approach. So it would be great if you
Hmm.
slightly approach the station slightly different. It will alert the examiner that this student has something different in it, in him, in her. Okay, so the first part is the grip part. Now, after grips, Draper, you asked one question that was great. There's only you need to ask one or two questions. That was fine. Then now, you explained about the color, clarity, and the odor of the urine in detail. Don't go in the details. You can just say it in 3 lines. Okay, Alex, what is the normal color of the urine? You think it's a normal color? Okay, it's straw color. That's great, and it's odorless, and the color is it's clear. So this is the thing. In 3 lines, you
Hmm.
have covered all the parameter, or 3 to 4 parameters. You have not wasted too much of your time. If in
I
you
tried.
are, now you are explaining now if at this point Alex asks you that
Hello.
doctor, what does the
Hello.
ball color? Hello.
There is too much noise in the background. I can't hear you properly.
This is someone is might mute. Okay, someone's might. Okay, now am I clear?
Yes. I tried doing that. Like when I asked you about the color of the urine, and you said yes, it is straw colored urine. I was like, do you want
Yes,
me to tell
that
you
was
more
great.
about it because I was not
Mhm.
sure.
Yeah, I
And you
noticed
told
that.
me
That was
to
great.
explain about the color, so that's why
Mhm.
I explained it.
Okay, okay, that was great. Okay, that is the point. If the student asks, then you have to explain. Otherwise, there is no need to ask. The one point. And moving further, your main task again is teaching. Okay, so when you are dipping a strip in the urine and then placing on the paper towel, now you need to mention that now I'm going to start the stopwatch. You start the stopwatch only once. Then after 30 seconds, you compare. After 40 seconds, you compare second parameter. After 50, third parameter, and then so on. You do not stop and start from time to time or more frequently. Like for 30 seconds, we are going to check one parameter. Then again, we will start the stopwatch again. Then we again check second or third parameter. You do not need to ask this.
Okay.
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 And otherwise it was good. Just time management and just try to improve in the beginning. It was great.
Okay.
And if anyone among the candidates would like to discuss this, would like to add any point, would like to add any opinion, then he or she is welcomed. Anyone? So everyone thinks that it was perfect. Okay, that's great.
Thank you.